Hello, my name is Jody Alcock, and with me today are two prominent periodontists, Dr. Tom McCauley and Dr. Steve Brown, who are absolute leaders in their field. Both of these gentlemen are pioneers in the use of the laser as an alternative to surgery in treating periodontal disease. One of the things that really sets them apart from others in their field is their use of a phase contrast microscope to diagnose and treatment plan patients suffering from gum disease. The purpose of our discussion today is to talk more about what this technology means to patients who are facing treatment and how it can lead to less invasive treatment options. So welcome, gentlemen.
Thank you. Thank you.
I'm going to put the first question out here to Dr. Brown. Dr. Brown, what can you tell us about the phase contrast microscope and how you're using it in your practice? How long have you been using this technology? What does it mean for your patients?
Well, we use the microscope routinely on any new patient as well as potential implant patients. And the reason for that is in the early 80s, Tom invited me to attend a course which was given by Dr. Paul Kais, which essentially emphasized the advantages of implementing the microscope as a diagnostic tool in treating the disease as an infection. I've used it in my practice ever since. And the key here is the word infection.
What would you add to that, Dr. Tom?
I think it's a breakthrough in treating periodontal disease because we actually diagnose the cause of the disease now instead of just the result, which is the way we used to treat it. So it's really, we've been using it for over 40 years, and it gives us a target to manage periodontal disease.
So the microscope allows you to see these organisms that are essentially living in your patient's mouth, causing this disease. Why is this important, and how does it help you treatment plan for your patients? Dr. Brown?
If you can visualize the enemy and the extent of the infection, that's a big thing, a big plus. Also, the treatment itself can be tailored to the specific needs of that patient. Additionally, by taking periodic microscopic samples before and after treatment, you can assess the success of your treatment, and your patient, more importantly, can visualize the improvement.
What it does is it helps us see the specific type of infection, as Steve said, and tailor the treatment, and also importantly, tailor what antibiotics to use. For example, if you see amoeba in there, you know that penicillin alone won't treat the disease. You need an additional antibiotic.
Interesting. So, I've personally heard many dentists and even other periodontists say that the problem with gum disease is that the gum pockets created by the disease harbor these bacteria. The treatment plan in many cases is to simply get rid of the gum pockets. Why, in your opinion, is this cut and sew approach to treating gum disease problematic?
Well, that's right on. Traditional cut and sew periodontal surgery treats the effects, Tom mentioned this before, and not the cause of the disease. Theoretically, there are pockets and the bacteria are in the pockets, and the theory is that if you eliminate those pockets, you're going to be better able to clean the teeth and therefore prevent the progression of the disease or the disease itself. But in reality, what happens is when the gum is cut away to the depth of the pockets, first of all, you end up with painful surgery, and it leaves the patient frequently with long, sensitive roots and large spaces between the teeth. The result is, in effect, that it's more difficult to clean now than it was before. And that's the reason, I believe, why we frequently in the past saw patients coming back after 2 or 3 years, and they had the disease again, and they're going to go through surgery again. that offended my sensibilities from day one.
Well, that's what got me started in this microbiology laser thing. Noticing, though, I was trained, Steve and I were trained at the best places in the world to do surgical therapy. And we started seeing, and the studies started showing that the results were not that predictable. So we started looking for something else that would help us, and more specifically diagnose the disease and treat it.
So in addition to this phase contrast microscope, what are some other ways you are working to identify specific gum disease bacteria? And how does identifying these bacteria help you plan a more comprehensive approach to curing gum disease?
Yeah, Jody, that's a great question. So in addition to the microscope, we often use oral DNA testing. Basically, that identifies the specific pathologic bacteria by their DNA. It's an early warning sign. It permits us to develop a very personalized treatment plan specifically tailored to eliminate the periopathogenic bacteria. In other words, in layman's terms, if we can know who the enemy is, we know what we can use, the tools we have to implement getting rid of them.
Right, so we also use DNA culturing, particularly on young people who come in with advanced disease way ahead of their time. They'll have a specific bacteria that we need to know about. Also, in failing implants, we need to use a culture from the Temple lab that will often show another bacteria called enteric rod, Pseudomonas, that also requires a different antibiotic. So it allows us to treat this disease way more specifically than generically, like most people do, just cut the pockets away, which, by the way, has been shown doesn't actually remove the bacteria very well.
So I've heard critics say that this microscope, that using this approach is a scare tactic to get patients to agree to treatment. Like, how do you respond to that?
Well, first of all, you have to know that when Tom and I started doing this stuff, I think both of us, to quote Shakespeare, suffered the slings and arrows of outrageous fortune.
Absolutely.
People thought we were kookaboos. But
which was partially true.
to answer your question about using the microscope, that would be like saying it's a scare tactic to use an electrocardiogram or a blood pressure cuff or a finger stick for a diabetic. It simply doesn't make sense not to use a tool that can help the patient manage their disease. And if you know what you have and the extent to which you have it, then the treatment becomes self-evident.
So, I mean, that's, it really, since the disease is painless, people come in, they don't even think they have a disease. So really, rather than a scare tactic, it's a wake-up call that you actually have something going on in your mouth. They say they think it's just food debris. It's not food debris. It's many, many different pathogens.
I couldn't agree more.
So someone has advanced gum disease and they're facing the reality that they very well could start losing teeth. What do you say to someone? Is there hope?
Well, absolutely there's hope. In this day and age, nobody has to lose their teeth due to periodontal disease. We have the knowledge and the technology available to treat virtually anyone who has periodontal disease. Let me tell you a little bit about the technology. Tom earlier mentioned the use of the microscope. And, excuse me, not the use of the microscope, the use of the laser. And laser light energy is attracted to colors. And the bacteria that cause periodontal disease, if you were to grow them in a microbiology lab, would have little colonies that are red, yellow, orange, and black. Now the laser light energy is attracted to those colors and consequently can kill the bacteria without any collateral damage to adjacent tissues. In fact, the laser light energy is used to remove tattoos, and that's the reason they can do it, because of the colors of the tattoos. So this is a very non-invasive way of treating people, kills the bacteria, and then if we give them appropriate follow-up treatment, then this disease is not going to come back. And one of the things that we do during the follow-up treatment is routinely make new slides that they can see on the microscope, so the patient can literally see their disease going away. That makes real believers out of them.
So what I'm hearing you say then is that the laser, this technology and the laser, can, by picking out colors, tell the difference between bacteria and gum tissue. So
Yes.
it will eliminate the bacteria and
Right.
leave the gum tissue alone.
So, absolutely. And I've done 2 studies that I've published in the literature showing that the laser will kill the bacteria virtually every time. So it's really a miracle. So people that used to lose their teeth, they'd come in, in the old days, Steve, we'd say, those teeth have to come out and you'd have to have a full mouth restoration or dentures. I'm surprised and amazed every week at some of the results that we get. It's startling. It's really a breakthrough, and it's rare that we can't save a tooth. So it's really it's a miracle, really.
It has truly made the clinical practice of periodontics more enjoyable, because it used to be like a death sentence when somebody sent you, because you knew that you were going to get cut. And you don't have to have that happen any longer, because we've got much better, much less invasive, much more predictable methods of treating it.
And, not too long ago, I think it was just expected that as you aged, it was almost inevitable that you were going to go to bed at night with your teeth in a glass beside the bed, right? Like everybody lost their teeth. It's just not that way anymore. And I think that's remarkable. So just in a nutshell, if there were one key fact that you would like our audience to take away from this video, if you had to choose one thing,
Yeah.
what would it be?
I can answer that, and then we'll hear Tom. Literally 80% of the people walking by the front door of my office today have some degree of periodontal disease. Get it checked out by a competent periodontist. Focus on treating the causes of the disease, not the effects. This is really essential today, given what we know about the relationship between gum disease and overall health. You are doing yourself an incredible injustice if you aren't having this sort of thing checked out. And it's simple, non-invasive, not painful, easy to do.
Ditto. I would say that find a periodontist who has a microscope, and then you'll be able to treat the cause of disease. We find now that they used to talk about periodontists generally talked about controlling disease like diabetes. It's not diabetes, it's an infection. We have an infection now, and you can actually be cured of periodontal disease. If you do your home care, you can stay cured. So it's really a breakthrough, and find somebody who does it.
If you take nothing else away from this talk, the fact that periodontal disease is an infection and can be essentially cured is a great message for all patients. And we truly, I think together, we've been doing this a long time, Tom and I.
I think it's 40 years.
Yeah, more years than I want to say. But
Yeah, don't say that.
I'm more excited about it now than I ever was. So it's a real boon, and it's a gift to patients.
So gum disease is an infection. We can identify the bacteria causing the infection. We have the technology to eliminate the infection. So gum disease is incredibly curable, and it's not painful. You don't have to go in for major surgery like it used to be, right?
Right.
You're a quick learner, Jody.
I have fantastic t-shirts.
That's the perfect message. Absolutely.
Yes.
Thank you both so much. This has been incredibly educational for me, and I'm sure all of anyone who views this video is going to find the same. Just a ton of great information. We'll put your contact information in here. Dr. Brown is out of Philadelphia, and Dr. McCauley is out of Fort Lauderdale. So we'll put their contact information at the end of the video. You guys can reach out to them for questions, or even a referral to a periodontist in your area.